With cases, hospitalizations, and deaths from the coronavirus now rising in states across the country, progress on a safe and effective vaccine cannot come soon enough. But once a vaccine gets a green light from the FDA, actually getting the vaccine out to the American public will pose yet another challenge. So how will the logistics for distributing an eventual vaccine work? Who will be the key players and who will be first in line? Bob Woodruff has that story in tonight's Vaccine Watch.
Right now, pharmaceutical companies say millions upon millions of their yet-to-be-approved COVID vaccine doses are now being manufactured, boxed, and stored in facilities around the country. The president's chief vaccine advisor is predicting that at least 2 vaccine developers are nearing the finish line.
My prediction is by the month of December, for the Moderna vaccine and the Pfizer vaccine, we will have between 20 and 40 million doses of vaccine stockpiled.
The plan now is to get these doses to those most at risk as soon as the FDA does authorize the vaccines as safe and effective, perhaps as soon as November or December.
It's actually pretty simple. The folks who are dying are nursing home residents and nursing home staff, so they're the ones we need to protect.
It's a complex plan, private companies taking the lead and the military and state officials coordinating logistics.
I told you we've engaged the military. We have a general who's in charge of all logistics who delivers soldiers.
There will not be this vision that some people have that there'll be army trucks driving through the streets delivering vaccine. That's not feasible or the right way to do it. We know how to do this, right? Commercial industry knows how to do it, and that's how we're going to do it.
2 of those private companies, CVS and Walgreens, have entered into a deal with the government's Operation Warp Speed to hasten distribution amongst nursing homes that opt in to the program.
It was really about being able to get to the nursing homes. And so for us, this is one of our core competencies. We're actually going to do over 400,000 flu shots this year in nursing homes, doing about 8,500 off-site clinics outside of our pharmacies. So this is something that we do.
Coordinating the deal for CVS, Senior Vice President Chris Cox says the company is prepared to distribute to at least 50% of the nation's nursing homes when a vaccine is ready.
Well, ultimately, we're going to be looking to get, to every nursing home that signs up with us as a partner, within a 3-week period.
One hurdle could be the need to transport and store some vaccines in below freezing temperatures, for example, Pfizer.
At the current time, we ship them at dry ice temperatures. We have a series of packaging where we get these trays, we call them pizza boxes, because they have roughly that shape, full of vaccine, and they're packed around with dry ice in these very insulated containers.
Another possible hurdle, hiring more staff to handle the millions of doses likely to be injected.
The administration has also expanded a guideline that will actually allow more low-level pharmacists to administer. Are you comfortable with that?
It's not something that is actually a new idea. There were already 5 states nationwide that allowed pharmacy technician administration of vaccines. There's an existing training protocol in place that the American Pharmacist Association has actually signed off on. It's very robust.
And as for the general public, Cox says getting vaccinated will look both familiar and a bit different.
We're going to make this effort, once we get to a general population stage, an appointment-only type of model.
So give me an estimate. Once this vaccine leaves the doors of Pfizer or whatever company qualifies, when would I be able to get the pharmacist in my room, or I go to the store and get the shot? How quickly would that be, do you think?
I would be speculating at this point. What I will tell you is we are prepared to start vaccinating in nursing homes before the end of the year. And we will be prepared, to take on a broader general population effort, within the first couple of months of 2021.
CVS added that along with residents, nursing facility staff will also have the opportunity to be vaccinated in the early days of distribution. This is Bob Woodruff, tracking the race for a vaccine.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.